Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone, and welcome back to another episode of Straight Outta Health IT. Today, we're coming to you from the 2024 Health Conference in Las Vegas, Nevada. I'm excited to be here this week, meeting with a number of different innovators, thought leaders who are disrupting the healthcare ecosystem. And today I have on our program one of those innovators and disruptors, Mr. Matt Swanson, co-founder and CEO of Reciprocity Health Incorporated. Let me tell you something about this man who's shaking up the industry right now. Matt is a seasoned innovator with a diverse career that includes significant contributions to corporate finance, e-commerce, education reform, and healthcare. He founded FindStationery.com in the late 90s, pioneering advancements in e-commerce and leading it to become the largest custom printing retailer in the United States before its sale to 1-800-Flowers. Wow, I didn't know that, Matt. Congratulations.
Thank you.
Additionally, as executive chairman of Innovation Schools, he drove educational reform by developing specialized school leadership programs for urban schools and supporting the launch of 4 Title I charter schools. Wow, we have that in common as well, too. In another life, I used to be the board chair of a network of charter schools.
Excellent.
Yeah, we should. Much more this man has done. Its healthcare journey began in 2012 as the governor-appointed chairman of the CMS SIMS-funded Delaware Center for Health Innovation, followed by work with healthcare innovators like CityBlock Health and Eleanor Health. His work driving transformation to value-based care inspired the founding of Reciprocity Health in 2020, which combines behavioral health economics and digital interactions to improve patient activation in Medicaid and Medicare. Under his guidance, Reciprocity Health has developed a world-class behavioral economics team and cutting-edge technology platform, TheraPay, which combines financial incentives with digital tools to significantly improve patient adherence to medical programs. Matt's focus on national growth efforts has positioned Reciprocity Health as a leader in financial incentive management and solving the complex challenges of patient engagement activation, particularly in most vulnerable and hard-to-reach populations. Matt holds a BS of Science degree from the University of Vermont and an MBA from Wharton School at the University of Pennsylvania. Thank you so much, Matt, for taking time to talk to us and my tribe at Straight Outta Health IT.
Thanks for taking us through that long history. I forgot I'd done most of that.
Hi, man, you have an awesome and amazing journey. So thank you so much for also now turning your attention to helping to transform healthcare. It is so very much needed.
Yes.
One of the things I like to do on my program before we delve into the topic of the day is for my guests to just share a little bit about their personal journey. What got you into this space? Was there something that led you to now wanting to focus on healthcare and specifically behavioral health in your life's journey that brought you here today and what brought you to the founding of Reciprocity Health?
That journey that you went through really were pieces of how I felt, like you said, the need for transformation. You don't really understand what's needed until you're in the guts of it.
Exactly.
So I came at it from the outside. I think that's been an advantage to some degree, but I would say the first inkling of really understanding what families and lower income families were facing was in the education portion.
Exactly.
Launching those charter schools and sitting with families as we're getting these schools off the ground and understanding what the kids were facing.
Absolutely.
Asking those kids to come in and study and succeed in the school setting when at home they're hungry or facing violence or their neighborhood is trending in the wrong direction, whatever it might be. Even before the term was coined in healthcare, you almost would call that the social determinants of education.
That's correct. I love that term.
And really understanding what challenges were driving our youth in the wrong direction, and then trying to build a system in these charter schools where we were accommodating healthcare and behavioral health into the school system itself.
Yes.
And then after that work, when the governor appointed me to become involved in his healthcare initiative that was being funded by CMS, he chose me because I was outside the healthcare system. This was a SIM grant that to drive transformation, statewide transformation. And he needed somebody who could come in and knew how to conduct systems change. I worked closely with the Secretary of Education, with the charter school system.
Sure.
He was familiar with my work there. But he needed somebody who wasn't coming out of the health plan camp or the health system camp.
Exactly. Bring a completely different lens to it.
So I came in, I played Switzerland, and it was there that I realized that families were facing those exact same challenges when it came to access to care and participating in the healthcare system. And that really struck me as something we needed to solve for.
Exactly.
And then the opportunity around value-based payment and the way funding can come in a much more fluid way and start funding some of these other challenges was really the open door.
That's a great overview of this journey you've been on. And you mentioned the social determinants of education, which I really like that term. And I remember when I sat in the role of board chair for a network of charter schools that focused on underserved communities as well, too, and some of the challenges they had around food disparities, transportation, both parents having to work or single parent households, those things that might have a direct correlation to the child's education, lack of access to internet, and trauma-informed education, all of those things. And if you create an ecosystem that allows a young person to thrive, the possibilities that exist in them really achieving academic success. And the school, this particular school I worked with, ultimately became the highest performing school in the district they were in as well, too, just because we took away a lot of those barriers for them. Just something as simple as clothing, for example, and wearing the same uniform versus having to worry about the different economic conditions of someone because they didn't have nice clothes or whatever.
And it's sad when you look out here at health and you see all the amazing innovation that's happening in all these silos.
Absolutely.
Different specialties, different, whether it's devices or digital therapeutics, or whatever, the innovation's happening here in this room, and you can see it in healthcare. The same doesn't happen in education. There's a systemic problem where the only innovation does happen in the charter schools like the one you were talking about. So that's a bright light, but it's not driving systems change.
No,
right?
it's not.
So
no, it's
that's a real challenge in education that we're really able to overcome more in the healthcare industry than the struggles they're having in it.
Yeah, I think we're seeing better progress made, but it's still slow progress too. It's still, and I'm thankful for people like yourself who come from outside of the industry and look at things a little bit differently as well too, and challenge the system and say, why are we doing it this way? Or why can't we do it a different way as well? I'm curious about this financial incentive model that you created under Reciprocity Health. Talk to us a little bit about how did you determine that was a social determinant to some degree, right?
Yeah.
And an influencer that would help drive better outcomes for family or an individual.
So there are a couple of things that came together. And one is this amazing study that CMS did that really showed the efficacy of financial incentives in Medicaid for chronic condition management.
Exactly.
They did a 10-state study, I think $87 million of funding, and showed great progress in driving people's activation in chronic condition programs. But that 500-page study that they published in 2017 also had a huge section, which was the challenges that it took place in those programs and why, in their determination, we weren't going to see financial incentives used effectively. Because the complexity and the administrative burden that was involved and necessary to do it right could not be found in the payers or the health systems. They're not built to have that specialized capacity. So it was from that work we really realized there was an opportunity to build a company purpose-built for that complexity and be that administrative partner that could help bring these programs where they needed to be. And so without us, you see the extent of financial incentives really coming about with the $25 Amazon gift card for a single primary care visit, for example. And that works to some degree, but there is so much more opportunity to take more sophisticated, higher budget financial incentives and move the needle in diabetes care or high-risk maternal health, you name it.
So I was actually going to ask you to give some examples of some of those incentives. You talk about the gift card, for example. Are there other things that Reciprocity is doing to incentivize those patients to change their behavior and take advantage of programs that you are now putting in place?
Yeah. So Some of the sophistication I was talking about has to do with a real orchestra of activity that has to happen around the incentive itself. There has to be really strong communication. There needs to be real clarity on what program you're actually offering.
Sure.
And then there needs to be a lot of support along the way. So we, first of all, the radical change that we took was to build our business as a managed service.
Oh.
So we're not just a software program that we're selling for somebody else to run.
Sure.
They would not run that effectively. And it's also an administrative burden just being shifted to them again.
Absolutely.
And we want them practicing medicine or delivering great clinical care. The engagement piece should be handed to someone else. So as a managed service, we help run that entire orchestra. And it starts with proper communication. So let's say there's a great diabetes management program that's out there, and it has excellent clinical outcomes, great ROI for either the payer or the health system that's running that program, everything that you would want, except very low adoption and low adherence. So they hand us that curriculum and that clinical program, and we design an outreach program, a communication strategy for the entire curriculum, whether it be 3, 6, 9, 12 months.
Exactly.
And then we have a digital application that becomes a roadmap, step by step, for that care journey. And then every step has an assigned reward value.
So is this a more like gamification type technology that's built into this?
Gamification is a component.
Right.
We use the term clarification more.
Okay.
Because gamification for me, it's like balloons and confetti and Candy Crush.
Sure.
That's not exactly what we do. For us, gamification is just clarity of steps, breaking down something that's typically very complex, often overwhelming or intimidating, and saying, you know what? Here are the first 3 steps in front of you. Let's go. So breaking it down, that's clarification. Motivation is all around the reward design. Our platform is built for flexibility, not just because we can accelerate any clinical program and we need the flexibility there, but also the field of behavioral economics is vast. And so you want to use different tools in that tool chest in different ways. So we have different ways of framing a reward, designing a reward for the appropriate moment.
Yeah.
And so the motivation is important. Motivation also comes with communication, nudging, reminding, encouraging people throughout the journey. And then the last piece is facilitation. Within the app itself, what we can do is serve up videos or a health risk assessment survey or an SDOH screen, whatever it might be, right there on the app. That's an opportunity in a 3-month care journey. If in the first 3 days you hand someone an SDOH survey, they complete it, they hit submit, and $20 shows up on that reward card in their hand.
That makes a difference.
That makes a huge difference in terms of motivation and confidence that they should keep going.
No, absolutely.
And so we like to build those tools into any program as well.
That sounds great. So tell me a little bit about the challenges that exist in the program and in the ecosystem that you're still managing and would like to see healthcare in general as an ecosystem change its perspective on.
Yeah, I still think, so we've seen great success in penetrating that inactive market within Medicaid and drawing people towards our program and towards their care, which is really inspiring to see.
Sure.
But that's first layer, and then there are deeper layers that are still sitting on the sidelines. And I think there's an incredible disconnect between the medical community and a population of folks that, for a variety of very legitimate reasons, it ranges from confusion to intimidation or even mistrust.
Sure.
And you need to overcome that. And financial incentives, especially high dollar ones, are a way to draw people towards that, but it can only get you so far.
Exactly.
So one of the things that we're doing is we have something we call the on the ground playbook, the OTG playbook.
Right.
And that is allowing community partners who have a trusting relationship with that community to be advocates of ours, because quite often we're in a position where families have already completed some of the tasks by default.
Exactly.
They took their kid to the doctor already. They went and got that lab screen already. And so when we meet them and we sign them up, we're actually giving them dollars on day one.
Oh, that's great.
And we've got Medicaid families that are earning $600, $700, $800 in a year.
Right.
And so the fact that we can start our relationship with them with money in the bank for them, there's an opportunity for a church or a community center or a charter school to be that conduit to help their own families out. And so they want that to be that partner with us. And it's a really effective way of reaching even deeper into that community. And it's beyond what the medical community could really do on their own.
No, that makes perfect sense. So talk to me a little bit about the sustainability model behind this. Obviously, you receive funding from the federal government, help launch this program?
Nope. All private funding.
It's all private funding.
Yeah.
So tell us about this sustainability model around this, because I'm trying to figure out, how does a company like yours, I don't know if are you for profit, not for profit? For profit.
I learned from the City Block team early on from Aya and Toyin.
Right.
I think you said you met them.
Yes.
If you envision trying to make a change in the Medicaid system at scale, you really need to be privately funded for profit in order to get the capital necessary to launch something that can make so. So it's a for-profit company, raised money throughout to build a technology platform and now scale. We've got a great capital partner and with Impactful Capital in Nashville. They've been amazing. But I'll tell you, the reason this is sustainable is because for every single program that we build, we do an ROI analysis for the client.
Right.
So whether it's a health system or a health plan, their challenge in a chronic condition management program that no one's using is that they're losing money hand over fist on the exacerbation of that condition.
Exactly.
That leads to hospitalization or ED utilization. These are expensive folks unless you get them into preventive care.
Absolutely.
And we do an ROI model that tells that payer, if you sponsor a program that pays $200 over a year for any one of your members to follow this preventive curriculum and be healthier and stay out of the hospital, here's the positive return that you will see.
That's great.
And so we do a specific ROI model on every single program to make sure that's the case. And it helps inform the budget of incentives that we're suggesting that they use. And the incentives come from the client. So they pay us to do our work, but we also set up a separate funding account that is the pass-through of all the rewards being paid out to their patients and members.
No, that makes sense. And so for an organization that's trying to develop a value-based care model in order to address some of these chronic conditions for the patients within their community, this becomes part of that overall strategy.
Correct.
That's amazing. And you can now actually be a conscientious capitalist.
That's right. That's right. I like that term.
Yeah, do good and make money at the same time. So tell me, why are you here at Health 2024 this year?
So we come always with a few different things on the checklist. We closed a funding round early this year, so that box was checked before we got here. Thank goodness.
Congratulations.
It's fun not to have to do that and really focus on the other things, which are even more important. So you can think of us as a general sort of accelerant of the performance of different clinical programs. And so we're certainly always looking for clients, health systems who are at risk and participating in value-based care, or health plans, Medicaid MCOs specifically. We're starting to get into MA. But so we're certainly looking for clients, but we're also looking for those clinical programs, and there are so many of them that are excellent in the care they deliver. And evidence-based, proven health outcomes, driving lower cost, everything you would ask for. But because they haven't built in this specialized capacity for driving volume.
Absolutely. And incentivizing behavioral changes as well, too.
Yeah. So we can come in and be a partner and make their business perform better. So it's nice to come to a show like this because you have the specialized care providers, you have the systems and the payers all here. And one of the things I love about this company is we're a rising tide. Like we can save money for the payers and the value-based participants on that side. We help providers deliver better care because they don't have to worry about chasing after their patients. The patients are actually coming to them. And that takes away that headwind that they typically face. And then we're making people healthier and putting a little money in their pocket at the same time.
I love it. But there's another reason you're here this year as well, too. You guys are a finalist for one of the recognition programs here. So
the Digital Health Award.
That's right. The Digital Health Award. So
that's
talk to my tribe a little bit about that. And
we've heard since we were getting our feet under us and had that as a let's apply someday, and we did it this year. And we got it through the quarterfinals a couple of months ago, and then just before the conference got word that we were now a finalist in our category.
It's amazing.
We'll find out later this week. Very excited about that. It's great recognition for the team, the technology team that has really built this from my initial thoughts of, wouldn't it be cool if, and then I let everybody else do the hard work. It's great recognition for them, both in terms of the technology build, but also the operations and delivering every day for our clients. It's a huge lift. And that's the big part of my co-founder, John Silvan, who runs operations and client success. That has led to enough evidence and data and performance that we can now use to showcase not just for an award, but for drawing the business and talking to clients and telling them what we can do for them in a really effective way.
It's not just a concept anymore. It's actually, we can actually show real value and real ROI to the bottom line. First of all, congratulations for being nominated and becoming a finalist for the award. It says a lot about the hard work you and your organization has done. As we wrap up this segment, if someone's interested in learning more about Reciprocity Health, how would they reach out and connect with you guys?
So reciprocityhealth.com is there. And then our product is called TheraPay. So TheraPayRewards.com is also, that's the website that the members typically interact with, or they can reach out to me at matt@reciprocityhealth.com. And like I said, we love to hear from providers and potential clients. We think we really can move the needle in Medicaid, and we're just now starting to get into DSNP and MA. So
great.
Very excited about the growth ahead.
Thank you so much, Matt Swanson, co-founder and CEO of Reciprocity Health, for taking time out of your busy schedule this week at Health 2024 to chat with me and my tribe. It's been a pleasure and an honor to meet you and get to know you, and I wish you and your organization continued success.
Thank you so much. I really appreciate you having me.
You're very welcome. Have a great day.
You too.
Take care.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.